ClimaWATCH is an interactive tool designed by Mathematica that provides a framework for communities to explore how heat waves impact health and magnify inequity. The tool synthesizes and summarizes data on heat and humidity, social determinants of health, and Medicaid claims to facilitate vulnerability assessments and identify geographic corridors and populations with high exposure to heat waves, high susceptibility, and excessive heat-related health issues. ClimaWATCH shows how heat waves have concentrated geographically at the national, state, and county levels, across the heat season, and from one year to the next. The tool aggregates temperature and dew point data and applies thresholds to flag days with extreme heat. With the data analyzed from 1981 to 2019, ClimaWATCH shows how communities' exposure to heat has increased over time. For example, in 1981, 1,543 U.S. counties experienced a total of 460 heat waves, which averaged 3.7 days in length and peaked in mid to late July. By 2016, the U.S. saw a doubling in the number of heat waves, with multiple smaller peaks earlier and later in the season. Across the country, 32% more counties were affected, including northern counties in the Midwest and several New England states. 2016 was a fairly hot year. Nationally, heat waves have increased at an average rate of 2.1% per year, but there is substantial state-to-state and county-to-county variability, as seen in the map of Texas. ClimaWATCH also shows how counties with and without heat waves differ in their vulnerability to climate change, based on social vulnerability indices developed by the CDC. Higher percentile scores indicate a higher likelihood that a community will need certain resources following a natural disaster or public health crisis. For example, in North Carolina, counties with heat waves had triple the minority population of those without heat waves, at 37% versus 12%, and somewhat higher socioeconomic vulnerability, at 67% versus 59%. Differences in exposure and vulnerability can lead to increases in a range of health issues. ClimaWATCH analyzes healthcare use and spending data among one of the most vulnerable populations in the country, Medicaid beneficiaries. The tool algorithmically quantifies excess healthcare use and spending that can be attributed to extreme heat by comparing healthcare visits during or shortly after heat waves with those during non-heat periods to parse out background use rates. Nationally, in 2016, even counties experiencing just a few heat waves per year saw a doubling or more in heat-related illnesses. Excess spending on heat stress was disproportionately concentrated in the elderly and in blind or disabled beneficiaries. With additional modeling, ClimaWATCH can tease out the extent to which increased minority composition and social vulnerability amplifies the effect of heat on health. The tool can also be customized to predict which hospitals will be overburdened by surges in heat-related hospitalizations, develop locally tailored thresholds for heat alert messages, and help public health officials address climate-related health inequity in their communities. Explore the tool for yourself to learn what ClimaWATCH can tell you about how heat impacts health in your community.